So I'm Michelle Clark. I'm the Stroke Service Coordinator at Barwon Health University Hospital Geelong. We're a regional centre located an hour outside of Melbourne metropolitan, and we treat up to 500 strokes a year, and we have over 1,000 stroke presentations a year as well. So as a regional service, we need to ensure that we're benchmarking with larger stroke services across Australia, and that we're providing the best quality acute stroke care to our community. You'll hear this terminology a lot in the stroke community, time is brain, and we know that 1.9 million brain cells die every minute that patient doesn't receive treatment. So when one of the blood vessels is blocked in the brain, they're not receiving any blood flow to that part of the brain, and we know the earlier we can treat that patient with thrombolysis, the better their outcome is going to be. From the patient arriving to our emergency department, we should be providing thrombolysis treatment within 60 minutes. Our OSCAR annual report came out showing that only in 2022, only 19% of patients were thrombolysed within that 60-minute target. And this was a decline from 25% the previous year. So it was really about identifying where the delays were for when patients were arriving. So we started off with looking at our pre-hospital stroke notification system. How can we ensure that there was that communication between Ambulance Victoria and our ED department to alert us when there was a stroke code on their way, and we were there at the door ready to treat the patient. So we reviewed our stroke code protocol system, and we made sure it was in line with the clinical care standards, the clinical guidelines for stroke management. So we've got new protocols for our stroke code system. We have early identification of a stroke code that's coming into our hospitals. We have direct to CT, so when patients arrive, we avoid offloading. We have a thrombolysis kit that we utilise in order to be able to thrombolyse our patients, even in some cases in the CT suite, to cut back on even 5-10 minutes of transferring them into a resus cubicle. We ensure that we've got a thorough checklist system in place before we thrombolyse our patients, because often in this time-critical and fast-paced environment, we want to make sure that our patients are still treated safely. Another key improvement that we were able to implement was simulation training. Simulation training is extremely beneficial in terms of allowing clinicians to practice their skills in a safe learning environment. It was a hands-on environment where clinicians could go through a stroke code process, and also allows clinicians to learn from each other and learn about each other's roles and responsibilities in that time-critical scenario. So we know there's a huge turnover with staff through the emergency department, and that will always be the case, and we need to ensure that we're providing that continuous education and training to staff within the department to be feeling confident to be able to provide the thrombolysis treatment. We're now trying to complete simulation training twice a year in order to capture the high turnover rate of clinicians moving through our department. So we've managed to shave back our door-to-needle time quite significantly. So 75% of our patients are now thrombolysed within 60 minutes. And this is a huge jump from only 19% in 2022. We know that this is going to have a significant impact on patient outcomes. So I think the foundation for implementing any quality improvement within your healthcare system is building those relationships and trust with all stakeholders involved. The thing we're most proud of is the collaboration that we've had with all key stakeholders across the stroke code process. So it's not just one person or one department, it's all the clinicians involved in the triage process, the medical imaging team, so the CT scanner, the stroke team, and the medical and nursing staff across the care continuum. Providing that positive reinforcement and celebrating our wins and achievements with the team is really important. We are currently providing feedback emails for every case that is thrombolised or sent for EVT to ensure our clinicians that were involved in that stroke code process understand the significant impact they made on that patient's outcome. So the clinical care standards, we're lucky that we have good evidence-based research out there that guides our clinical practice, provides meaning to what we do, and it's a real foundation of implementing any quality improvement project. Referring regularly back to the clinical care standards and the National Stroke Guidelines, and also benchmarking with other healthcare services was key in order to implement any process change.